The next step in any next-gen case is going to be to take action. And here, what will I do? We already kind of hypothesized about those potential things that could be beneficial or harmful. Now in step 5, we actually take the action. Should I do this or that? How do I do this to address that priority problem? We're going to look at a different example, this time from our heart failure case. And here we're being asked, the healthcare provider diagnoses the client with heart failure. Which of the following healthcare orders should the nurse prioritize? So revisiting our framework for prioritizing, we're looking at actions that are going to help us address problems of airway, breathing, or circulation. Again, similar to step 4, this depends on your understanding of heart failure, the disease process, and why certain treatments are indicated for it. So in heart failure here, this client is very short of breath, they've got a low oxygen saturation, and we are able to see in our assessment that they have got crackles in their lung fields because they're fluid overloaded, they have pulmonary edema that's preventing that gas exchange. So you want to prioritize something that's going to get that fluid off, right? So let's look at which option might do that. Preparing the client for a chest x-ray. This is important, and you might even want to pick this if you're using the simple rule of assess first, right? But in this case, I kind of already have all the information I think I need to decide that there's too much fluid and I need to do something about the fluid overload. So I'm not inclined to pick preparing the client for a chest x-ray. Then administering enalapril. Enalapril is an ACE inhibitor that's given as an antihypertensive. So when I look at my blood pressure here, it's 149/93. That is high, and that has the potential to further overload them and is therefore sort of an issue of circulation. So that could potentially be a priority action I want to keep in mind. Then giving 40 milligrams of IV furosemide. This will address that fluid issue, right? It's going to pull the fluid off. That's going to fix the problem I already decided was my priority, so I'm going to keep that in mind as likely a priority action. Then finally, preparing the client for an echocardiogram. Someone with heart failure does need an echocardiogram to visualize the structure and function of their heart, but again, similar to our chest x-ray, we have enough information to already know that we need to get the fluid off, and that is what we're prioritizing. So that leaves me with these two options, giving enalapril or giving furosemide. Enalapril would be to address the blood pressure, but you know, because you understand heart failure, that giving Lasix is not only going to pull the fluid off, which is our priority problem, but it's also going to have a secondary effect of lowering the blood pressure. Being IV, it's also going to work much more quickly than PO medication would. And in this case, we need to act quickly because we have a low pulse oximetry reading. So I'm going to say, yes, that is my priority action. And that is correct. Then your final step in any next-gen case is to evaluate outcomes or decide, did it help? Did everything that I've done so far in this case help to correct those priority problems? In other words, what would I see improve if the interventions corrected the problem, or what signs would indicate a complication has developed? So we're going to look at this example from our burn case, where this client came in involved in a house fire. They sustained heavy burns and an inhalation injury where they inhaled smoke, had airway edema, so they were intubated and placed on a ventilator for airway protection, and then given large volumes of fluid in order to fluid resuscitate them. We're being asked, click to highlight the findings that would indicate the client is not progressing as expected. So not progressing as expected means we're looking for unexpected abnormals. So let's take a look. The client is intubated on a ventilator. Well, that's definitely abnormal. It's abnormal for any client to require airway protection. That person is clearly very critically ill. But this is a therapeutic intervention that we put in place to maintain airway patency. It is abnormal, but it's expected. It tells us their airway is patent, whereas before there was a risk of them losing their airway. So that is not indicating they're not progressing as expected. Then moving on, the endotracheal tube is 22 centimeters at the teeth. The client has crackles throughout all lung fields. And you know, because you understand the risk of large volume fluid resuscitation, that if we give too much fluid too quickly, they could become overloaded and develop pulmonary edema. And you would know that happens because you start to see respiratory insufficiency, and when you listen to their lungs, you hear crackles. So yes, that indicates they're not progressing as expected, that they may have been developing a complication. Similarly, edema, we've fluid overloaded them, and then because they have burns, they have increased capillary permeability, and all that fluid that we gave didn't stay in their vascular space, but went into their lungs, and in this case, also into their peripheral tissues. Reading on, the cardiac monitor displays sinus tachycardia at 106. I want to look at my prior heart rate, and they came in already higher than that and then became very tachycardic before they were intubated. So they were clearly having a strong stress response to shock and hypoxia. Now their heart rate has improved to 106, and although it's fast, it is a sinus rhythm and it is improved from before. So this indicates they're progressing just like I would expect them to. Client has dry dressing in place covering the burn to the neck area, indwelling urinary catheter in place with 20 milliliters of urine output over the last 2 hours. You know, because you understand burns, that your urine output is a really sensitive indicator, especially when you might not be able to assess capillary refill or pulses because of burned tissue. Instead, your urine output tells you how much perfusion is getting to the kidneys. And so 20 milliliters of urine output in 2 hours is not enough. We want to see at least 30 milliliters an hour at minimum. And this client only has 10 milliliters an hour. So that is not adequate. They're not progressing as expected. Maybe because all of that fluid went into their lungs instead. The urine is a dark amber color. Concerning for the same reason this is. They are not adequately fluid resuscitated. They're still volume down. Client is sedated and opens eyes to verbal stimulation. This is what you want with someone on the ventilator. You don't want to completely knock them out because then it's eventually very hard to wake them up once they improve. You want them sedated to the point that you say their name and they open their eyes. That is exactly the mental status we've achieved. That means that they are sedated at an appropriate level. And that's how we evaluate outcomes. So I hope that was helpful to walk through each of the 6 steps. Stay tuned because next we'll discuss strategies for approaching specific next-gen item types.